It's a disease that affects more than 1 in 3 U.S. adults and about 1 in 5 kids and adolescents. Tonight, we're talking about the obesity epidemic and how we can all make lifestyle changes. Good evening and thanks for joining us for WTVP's Docs on Call. I'm Mark Welp. Fighting obesity isn't just about looking and feeling better, it's also about saving lives. It's estimated that obesity contributes to hundreds of thousands of deaths every year in America alone. Dr. David Tennant works for Carle Health. He's a family medicine doctor and also leads the obesity medicine clinic at Proctor Hospital in Peoria. Doctor, thanks for coming on.
It's good to be here.
Appreciate it. Well, first of all, let's define obesity for people. What's the difference between being overweight, being obese, being morbidly obese?
Yeah, that's all good questions. So it's usually defined based on the body mass index. And it's nice because it's easy to do. You can do it essentially for free. It's just your weight versus your height. The basic idea is if someone's 200 pounds, well, are they 5 feet or are they 6 feet? Right? This is a different thing in terms of how much fat you're likely accumulating on your body. But it's broadly defined. Below 25 is normal. But 25 to 30 would be overweight, and then 30 plus body mass index is obese. And when you get to be above 40, then that's class 3 or morbid or severe obesity. And it's not like totally perfect. You know, some people have more muscle bulk than others, and you kind of know it when you see it. I looked it up once, the average BMI of the starting linebacker corps for the Chicago Bears, and I think they were on average obese. These people are obvious, they're just incredibly muscular. But for most people, most of the time, it's a pretty good, inexpensive estimate of where we are.
Okay, so doctors still using that formula for the most part to diagnose people. Okay, good to know. So talk about a little bit about what you do at Proctor Hospital with the clinic and how you help people that are having issues with losing weight.
Yeah, so to your point, it's a very common problem. It's 70% of US adults are either overweight or obese, 40% are obese, and 9 or 10% are severely obese. And this problem has been going up significantly over the years. If you go back in time, like 100 or 120 years ago, nobody really knows what the percent of the population was that was obese, but it was probably around 1 or 2%, or maybe even lower. I mean, it was really just a fraction of a fraction. It's done nothing but go up over that time. Now, those numbers I just said, I want to say it's a 2023 CDC number. I don't know when the CDC is going to next come out with some new numbers. It wouldn't surprise me if it starts to tick down for the first time in who knows how long, but I don't know that for sure, and it still remains a big problem. So what do? We approach obesity a couple ways. So first of all, we treat it like a chronic disease, something akin to like diabetes or blood pressure or cholesterol, where of course lifestyle stuff plays a role, right? That's obvious, nobody's disputing that, but there's also hormonal factors which are not a personal responsibility thing, and where medications or maybe even surgical options could be useful for them. And overweight, obesity, weight generally, poor metabolic health, we approach it very broadly one of 3 ways, and you should certainly think about all 3. Nutrition, which applies to everyone, and then plus or minus medication or surgery, or surgery.
Gotcha. So let's go back to what you were talking about how the obesity, how it has become an epidemic.
Yeah.
Why do you think that is?
It's an interesting question. I don't know if anyone knows it for sure. It's a multifactorial problem. What I could tell you is right now, the average American consumes 55% of their calories from an ultra-processed food source. And stipulated, the term ultra-processed, it's not like precisely defined. You might get slightly different definitions, but you know it when you see it. The basic definition is if you didn't make it or your wife didn't make it, it's fast food, right? So if it's coming from literally a drive-through or something frozen or in a bag, something that you could not create in your own kitchen, it's an ultra-processed fast food. And these tend to be obesogenic for a variety of factors. Now, is it the sugar? Is it the refined grains? Is it something else like all the salt or the pesticide? You know, who knows? Like the microplastics, I don't know. There's all sorts of possibilities, but very broadly, it does seem to be the combination of large percent, the majority of our calories coming from an ultra-processed source, reduced exercise, because we're doing less physically demanding work, that plays a role, less than nutrition, and And yeah, just the environment. And there's no question about it. The weight's been going up over the years.
But you mentioned that you wouldn't be surprised if it goes down a little bit
Yeah.
when this next set of info comes out.
Yeah.
Why is that?
I have two theories. The first is kind of the obvious, the use of GLP-1 medications. This has been true for, you could maybe say 10, but certainly over the last 5 years. GLP-1s to address weight as a chronic disease is in widespread use, and it's all over the news, and I'm sure everyone has at least some passing thoughts on it. The other thing, and I don't want to give short shrift to it, I think the knowledge has changed. Knowledge is kind of everything. I heard it once before that we have all the same resources as cavemen. Actually, we have less because we've used some of the resources in the ground, right? But what we have that they don't have is the knowledge of how to use them. I was born in 1985. I remember shopping with my mother in the 90s. It was fat-free everything. Like, I can't believe it's not butter, et cetera. You can still go to the candy aisle today and you could find something listed as a, quote, fat-free food. And it's true as far as it goes. There's no literal fat in this thing in a package, but they're not answering the question that you're asking. The question that you're asking is, I, as the consumer, am I going to get fat? And the answer is yes. So it's not really like a fat-free food. And I think this is changing, where we're kind of understanding all of these, the classic boogeyman is the food pyramid, which was, it was taught to every school child, at least when I was in school.
Yeah.
And just these huge quantities of refined grains, and that's just, what's the word? Bad advice. So, and that seems to be going away, reducing the added sugars, reducing the refined grains. People do seem to at least coming in to see me, to know that. Like how to execute that, I'm not saying it's a simple problem, but at least conceptually we're understanding it. So I think it's a combination of medical advances and just improved knowledge across the board.
And to your point, it seems like, these days everyone knows smoking is bad for
Yes.
you. Most people have always known that, but now it seems like everyone knows it. And people, I think, they're not confused necessarily by what I should eat or how much I should eat. So the question I've always had, and I've dealt with this my whole life, trying to lose weight, and it's been a roller coaster, how much of it is psychological? Because it seems like, you mentioned there's hormonal things that you can't control, but it seems like when you drill down, a lot of it's a matter of just self-control.
That's in there. Well, first of all, I'm glad you mentioned the smoking. I don't know if people know this, but if you go back in time to the 50s or 60s, it was something like 40 or 45% of American adults smoked. Now it's below 15. I think it's pretty close to 10. So
doctors used to be in commercials saying you should smoke these kind of cigarettes.
Is that right? I didn't.
Yeah.
It's wild. So anyway, big public health things can change. How much of it is psychological in terms of diet? That's going to be tough to define. What I will tell you is, if you avoid, very broadly, that kind of works for essentially everybody, don't drink your sugars. There's something, I don't know if you do it now, but there's something about drinking your sugars.
I love soda. It's crazy.
Yeah, don't do that.
Okay.
There's something about drinking sugars. I've seen people who, over long periods of time, have done all kinds of interesting things with their diet, beneficial things. And then for whatever reason, they won't stop, insert sugary drink here. Like the soda is the only thing that works for my heartburn. I just really enjoy the juice. It's I don't know. But for whatever reason, they don't stop drinking their sugars, they don't lose weight. They might get healthier in other ways. Mm-hmm. So that's a pretty good starting place across the board.
Now, what about for people, since you brought up soda, what about people who say, okay, I'm going to switch to diet? Is that any better?
Maybe, kind of.
A little bit?
Maybe. And, everything, look, it's a free country. People could do as they want. It's not illegal or immoral to be overweight. There's nothing wrong with it necessarily. But if you are actively trying to lose weight and get healthier, to my knowledge, the number of people who lost weight and got healthier by switching from regular soda to diet soda is, I believe, roughly zero. And there's something about it, and I don't know what it is. Whether it's still a sweet taste, so we still hormonally get these insulin surges and it still contributes to leptin resistance, or it just kind of makes us hungrier, or maybe to agree, because it doesn't taste good. We're kind of lying to ourselves in the sense that, it's diet, it must be healthy for us. I don't think so. It's pretty metallic. It tastes more or less like the can that it comes in, and there's something about losing weight where you just have to be ruthlessly honest with yourself, and if you're going to do it through diet, and I'm not saying I always live up to these standards that I'm setting out here, but a cardiologist addicted to cigarettes should still tell people not to smoke. It's bad for you.
Sure.
You can't know or understand everything that's in, say, like a diet drink. And if you don't really know what you're consuming, you're asking for trouble.
Okay, noted.
Yeah.
You know, you mentioned it's not illegal. People shouldn't be ashamed to be overweight, and we don't want people to feel like that. But being overweight obviously does have an impact on your health.
Oh, no question. And to your point, like shame is bad, but sometimes we take that too far and we say you have no responsibility for it. Like shame is bad, responsibility is good, is maybe the right framework to think of it. And yeah, obesity and poor metabolic health, it's a risk factor for just about everything that plagues us today, right? Arthritis, diabetes, cholesterol, blood pressure, probably the worst of the bunch and the least diagnosed, obstructive sleep apnea. Mm-hmm. People just aren't sleeping at night, so they're tired all day and just their quality of life is no good. Yeah, it is a risk factor for essentially everything, and it's good to target it.
So it's kind of a chicken and egg thing. You know, if you're obese, then what you just mentioned, you know, those numbers can go up. But if you're not obese and you do have some underlying health issues, what kind of underlying health issues can contribute to you being obese?
It's an interesting way of putting it. Yeah, to your point, so there is a condition called metabolically healthy obese. What that means is the number on the scale is high, stipulated. That said, when you actually look at the labs or the blood pressure, they don't really have the problems that I just mentioned, right? The blood pressure, the cholesterol, the diabetes. So these people do tend to develop these problems over time because the fat itself is hormonally active, and so fine. If you flash forward 5 or 10 years, they're at a higher risk for developing these things, but it's not definitional. There are some people out there who are metabolically healthy obese, and the opposite is also true. It's called normal weight obesity. And what that is, according to the body mass index, their numbers look, if not normal, maybe slightly in the overweight range. And then you pull up these labs and it turns out they have all the things, right? Mm-hmm. The blood pressure, the diabetes, the cholesterol, or at least some of these things. And then you approach it the same way that we've always approached blood pressure and diabetes. You know, there's anti-blood sugar medications and blood pressure medications and cholesterol. And there's still, the diet advice, okay, fine, the number on the scale is not that high. The diet advice is still good, you know. Try to avoid added sugars, try to avoid white flour, try to avoid ultra-processed fast food generally, and you know it when you see it. Yeah. And cook more at home, you'll get better.
So that's what we hear. The big things: eat healthier.
Yeah.
Don't eat as much. Exercise. Seems simple, but yet we have an obesity epidemic.
Yes.
So when people come to you and say, "Doctor, I need to make a change in my life,"
yeah,
where do you start?
Yeah. So to your point, it's something like 80% of people who just try to go diet and exercise end up failing. Now, failing could be a step on the way to success, right? Just because you failed once doesn't mean you don't try again. Because diet and exercise is never going away when it comes to obesity and health management, ever. There's no medication or surgery that changes that. I very much doubt that there will ever be a medication or surgery that changes that. But here's where, and I'm not a surgeon, I do medical, but here's where a medication like, say, a GLP-1 might be useful. Let's say someone comes in and they're seriously overweight, BMI 35, 40, all the things that we talked about, the blood pressure, the diabetes, the sleep apnea, you name it. And they say, okay, I want to get serious about my weight and my health right now. Stipulated, I've spent too many years, focused on fast food and not exercising, but let's not belabor that. Let's focus on the future right now. Cool, happy to help. They're going to start from a place where their own hormones and to a degree, basic physics is working against them. What I mean by that is when somebody is obese and in poor health, they tend to be leptin resistant and insulin resistant, meaning they are literally hormonally predisposed to eat more food, to not feel full, and then pack it on as extra fat, which is not fair, but it's where we are. And the basic physics problem of it is, if somebody's 300, 350, 400 pounds, I, as a doctor or someone else can say, go exercise, and it's good advice as far as it goes, but we're talking about a large amount of mass that has to be moved. People come in and they tell me, and I believe them, it hurts just to roll out of bed. Go exercise. It's true, but it's lacking a certain realism. Mm-hmm. So what something like a GLP-1 medication might do is, to use a cliche, slows down the food noise. What it literally does is it slows down gastric emptying, meaning it slows down the movement of food from your stomach lower down to your intestines. So food sits in your stomach physically stretches, nerve on the outside tells your brain stop eating. So we do less quantity. When we do less quantity, we tend to do a better job with quality just because we're doing less of it. And that alone, if you were to go online and look up an average, you're going to get a number like 10, 15% total body weight loss, maybe a little bit more than that. And from there, since they're doing less of it, people are able to get some of their diet under control. Once the number on the scale starts to go down, and it's just physically less mass that they have to move, and this might take 6, 12 months depending on where we're starting from, but then they are able to start exercising.
So you mentioned GLP-1 drugs, which over the last 5 years have just exploded.
Yeah.
Some numbers I looked up right now, about 1 in 8 U.S. adults say they're taking a GLP-1.
Wow.
Since January, more than 600,000 prescriptions have been written for Wegovy, one of the big brands. We're talking Wegovy, Ozempic, Zepbound. All right, so with these drugs, I mean, everyone's always looking for a magic bullet, magic pill. And this seems like it's not going away. It's just getting more popular. So are you seeing results from people who are taking this?
Yeah, and it's a tool, and it works for all the reasons that we just talked about. They just kind of do less quantity, so they tend to do a better job with quality. We can talk about some of the common side effects of these medical side effects, and they're real, and they should always be discussed and considered and looked out for and all those things. But I'll tell you, for most people, most of the time when they have an issue with these GLP-1s, it's not medical, it's financial. They are just awfully expensive, and there's no reason to think that's going to improve anytime soon. Frankly.
A lot of insurance plans just won't cover it.
Yeah, that's true. I mean, they're expensive. I mean, you get it. Everyone hates their insurance company, but it's a business, and their margins are narrower than you might think. And I don't work for them or take money from them, but it's just true.
Yeah,
it's a tough business, and it's not a discount card. I mean, it's a business. So anyway,
well, with paying all that money for a shot like this, does that in a way help people? You think, because now they're really invested in making this work?
I don't know about that. No, because they could use the money for like healthier food and all kinds of stuff. It's an interesting theory. It'd be tough to,
Well, what do you think about, before there were GLP-1s, there was gastric surgery, lap bands, things like that. If someone says, I want a GLP-1, would you say, okay, well, let's look at your history of trying to lose weight? Or would you say, let's just give it a shot and see what happens?
Well, it all kind of depends. Just to answer the original thing. One of the ways this is never going to happen, so I don't mind just saying it on TV, but I think one of the ways we could handle the cost of it, just make it over the counter. I mean, really, all medications carry side effects, including over-the-counter medications. If old-fashioned, like free market economics, I wonder if these things just got cheaper and more accessible and better for the consumer and all sorts of stuff. But anyway, do I just blindly start a GLP-1? No, every patient is a little bit different. Right, so there are some black box warnings where you just can't go on it. For example, it's not approved should you get pregnant. Right, so young women of childbearing age, that's something to consider, especially if they're actively trying to have children in the near future. Another one is something called medullary thyroid cancer, which is a rare form of thyroid cancer. It's rare, but I ask everybody, whoever comes in, hey, do you have any personal or family history of that? And then I go over the side effects. So medically, so if you think about it, the medication works by slowing the movement of food down. Right, so people tend to get side effects going the other way. So nausea, heartburn, constipation, counterintuitively diarrhea. This is all pretty minor stuff, really. I mean, we've all kind of experienced this. It's not that scary. If you're patient, it probably goes away. If it doesn't go away, you can stop the medicine, it goes away. It just doesn't require a ton, really, to manage, but it absolutely should be discussed every time.
When you quit smoking, eventually your heart gets better, your blood pressure gets better, your lungs can heal themselves. When you lose weight, are you going to be able to get rid of all those issues you had, the high blood pressure and everything else eventually?
Maybe. I'm reluctant to just blanket promise it'll go away, but there's no question about it, it'll get better. It's a common thing in my clinic where someone comes in with the diabetes, the blood pressure, the cholesterol. They go on the weight medication. So at first we're adding a medicine. But 6, 12, 24 months from now, their total pill load, the number of medicines that they're taking has gone down significantly because all of the above. The blood pressure medications got reduced or stopped. The other diabetes medications got reduced or stopped. So in total, you'd call it controlled, I guess maybe the right, as opposed to gone.
Sure. Can you give us, just for folks watching who want to lose weight, maybe they're not obese, but they've got a few pounds they'd like to get rid of. Generally speaking, where would you start with people?
So the best thing you could do is make foods at home from scratch. And you know it's from scratch when you do it, right? Just raw ingredients that you cooked. But if you're going to eat processed foods, you want to turn everything around. Trust nothing on the front. These are marketing terms. You can't trust it. Yeah, turn it around. You're looking for added sugars and white flour and other refined grains, like corn and soy products, all these sorts of things. These things tend to promote weight gain. So added sugars and refined grains, if you're able to reduce or even eliminate that, specifically the sugary drinks, for a lot of people, that alone is enough to help them lose some pounds.
Okay. You mentioned looking at labels earlier and how everything used to be no fat or low fat.
Yeah.
And that you still see those labels,
Sure.
and it's confusing, I think, for people because, let's say you look at a bottle of salad dressing, it says low fat. You look at another bottle, it says low calories.
Yeah.
Another one says low carbs.
Yeah.
How do you know which bottle to buy?
Yeah, it's a good question. I could tell you which one I would buy, none.
Yeah.
I mean, I think you're better off just making a salad dressing. It's easier than people think. If I had to choose from those three, the low fat, the low or no fat, the low calorie or the low carb, I guess I would probably pick the low carb. But again, these are front labels, right? You really do want to turn it around and look at the back and see how much sugar they're putting in there.
And if you look at those labels and towards the bottom, when you see all the words that you can't pronounce and you don't know what they are, is that a red flag?
I would say so. Yeah, that's bad news. I can't speak for every single one of these ingredients, but just broadly speaking, as these types of ingredients, these indecipherable, ultra-processed ones that you could not create in your own kitchen, have gone up in our diet, the obesity epidemic has gone with it. That's a correlation, not a causation, but I mean, it sure seems related.
Sure. What are your thoughts on diets? Because that, before GLP-1s and things like that, that was, try the keto diet. Try this diet, that diet. I mean, are there any diets that you think are better than others?
I don't have like a specific horse in that race. Broadly speaking, if you're dieting, I always, make your own foods. I know I keep saying it, but it's true. It's just really good advice, and it tastes better, and it's actually surprisingly cheaper, and so just do it. Now, I think different people might respond differently just for whatever reason. Maybe it's just as simple as their palate. They just don't like eating meat, or they really like eating meat. I don't know. And they can go plant-based, or if not keto, something keto adjacent where you're going low carb. These are all potentially right answers. Whatever works for you.
How beneficial do you think it would be for someone who's trying to lose weight to consult with like a dietitian or nutritionist?
It could help. I think if someone's really honest with themselves, where they keep a strict food diary for a week. Don't do it longer than the week, you'll be a basket case, but anybody would be. But for 1 week, everything that goes in your mouth, you write it down. And you're looking for ultra-processed stuff, you're looking for added sugars, you're looking for refined grains. And it's not gonna go to zero, it's really challenging, I do understand that. But you're able to, I didn't have to, I eliminate that and I could have more whole foods here. If you start with that might be enough for a lot of people, but not for everyone. Right, and so for people who on their own want to stay out of the medical mill, let's say, and they want to work on their own and they're still not having the success they were looking for, by all means, go see a formal nutritionist, see someone, either me or someone like me, a doctor. So, yeah, but you can, most people can try on their own at first.
Sure. With your experience in working with people who are obese or trying to lose weight, what do you find is a good motivation for those people? I mean, with people, I guess it can be anything from saving money to being healthy to whatever, but is there any one thing that you think really helps people?
That's an interesting question. I want to answer it with a no, but not like one thing. But a lot of people come in and they're almost, but they're almost over motivated. Like they spend so much of their mental energy thinking about it for so many years, they're just essentially exhausted before they even get started. And a lot of times it's all about, it's not illegal and it's not immoral to be overweight. You don't have to do anything. If you're happy with your life and your body the way that it is, cool. I have great. And just that, I find that relieving of a little bit of that burden is helpful.
Anything else before we go that you want to tell us that we haven't talked about in terms of helping folks lose weight, or myths, misconceptions, anything you want to break out there?
Yeah, people think eating healthy foods is expensive. It's not true. They've done studies on this. The people look at the grocery prices, and it's true they go up over time. But I think what people are doing is they're thinking in terms of nominal, not real terms. They're not adjusting for inflation. Let's say over the last 2 years, your wage has gone up by 8%, but grocery prices have gone up by 4%. These are real numbers, by the way, of like the average. Have groceries gotten more expensive or cheaper? I think most people would say expensive because the number went up, but if you actually compare it to how much you're earning,
sure,
it's cheaper. And it's just been true over, if you go back in time, the amount of discretionary income that Americans spend on their groceries has almost cut in half over the last 60, 70 years, never mind the fact that we all have cooktops and ovens and dishwashers and easy recipes online. Learning from a cookbook is really challenging, but learning from YouTube is very easy because it's infinitely patient and the recipe is spelled out for you. So what I would say is cooking and using whole foods is cheaper and easier than ever. So by all means, take advantage.
Well, Dr. Tennant, we appreciate all the information. Dr. David Tennant with Carle Health. He is the lead at the Obesity Medicine Clinic at Proctor Hospital. Thanks for all the advice. We appreciate it.
Happy to be here.
All right. And thank you for watching. You can watch this show again and share it with your family and friends. Just go to WTVP.org. Find out about future show topics on our Facebook and Instagram pages. And as always, we want to know your questions and topic suggestions. Message me on social media or leave a comment. Thanks for watching and take care of yourself and your family.